Welcome everyone. It's me again, Dr. Kamal Dahab, a teaching assistant at the Anatomy Department, Faculty of Medicine, University of Khartoum. Today, inshallah, we will start a new module for the practical sessions at the dissection room. And in this module, we will cover the lower limb in number of 5 practical sessions. And when we say the lower limb, it is the region that extends below the pelvis, and it composed of 3 regions, namely the thigh, the leg, and the foot. And the thigh area is the area between the hip joint and the knee joint, and the leg between the knee joint and the ankle joint, and the foot is an area that found beyond the ankle joint. So the thigh and the leg regions is composed of what is known as the compartments. And when we say compartment, it is like a closed room that enclosed with the fascia, which is thickening, and every single compartment contains its own muscles and neurovascular structures. So when we will discuss, inshallah, the thigh and the leg, we will discuss it as compartments or compartments and its contents. Okay, so today, inshallah, we will start the lower limb practical sessions by the first practical session, and it is about the osteology of the lower limb. The first station in this practical, it's supposed to be the articulated pelvis and the hip bone, but we have covered this station in the previous module of the pelvis and perineum, and you can find this station at the first video in the first practical of the pelvis and perineum. So we will cover the other bones that forms the lower limb, namely the femur, which is here. It is the femur, and articulated with the femur is this small soap-like bone. It is patella. And then we will discuss the tibia, the fibula, and see all 3 together articulated to form the knee joint here. The femur, it is the superior one here, and the tibia and fibula, it is the inferior ones. And lastly, we will discuss the foot, and then we will see its articulation distally with the tibia at the ankle joint. So let us start our first stage. Okay, in this station we will discuss the femur, as you can see in front of you, plus a small bone that articulates with the lower part of the femur, and it is the patella. Okay, the femur, it's actually regarded as the longest bone in the body, and you can see here is the right femur. It has 3 parts. This is called the upper part or the upper end, and here down in the lower end, and we have the shaft in between. Okay, so let us see the upper end in details. The upper end had this rounded structure. You can see it clearly like this. This hemisphere rounded smooth structure is called the head of the femur. The head of the femur will articulate with the acetabulum to form the hip joint, and in the center of the head of the femur we have this depression. It is called the fovea capitis, and it is for attachment of the ligamentum teres of the head of the femur. Okay, then attached to the head we have this narrow area. It is called the neck of the femur, and the neck of the femur will form almost about 125 angle with the shaft of the femur. Here it's about 125 degree angle, and the head itself, it's a little bit forward from the plane of the neck. Okay, it is a little bit forward from the plane of the shaft. Sorry, it's a little bit forward. Then following the neck of the femur, we have these two protrusions. Here it is the larger one, and here is the smaller one. Okay, the larger one here, it's called the greater trochanter of the femur, and the smaller one here, it's called the lesser trochanter of the femur. Okay, then in between the two trochanters from the anterior surface, this is the anterior surface, in between the two we have this line that adjoining the two trochanters. It is called the intertrochanteric line. Posteriorly, we have this line that adjoining the two trochanters. It is called the intertrochanteric crest. Then the intertrochanteric line, it is found anteriorly, and the intertrochanteric crest found posteriorly. Almost in the center of the intertrochanteric crest, posteriorly, you have this elevation. It is called quadrate tubercle, and the quadrate tubercle for insertion of the quadratus femoris muscle, which is one of the muscles that forms the deep gluteal musculature. Okay, we will discuss it in the gluteal region. Okay, regarding the greater trochanter, it has many muscular insertions. Okay, it is an area that has many insertions from the outer part. Okay, here in the anterior surface we have the insertion of the gluteus minimus muscle, and in the lateral surface of the greater trochanter we have the insertion of the gluteus medius muscle, and on the inner aspect here of the greater trochanter we have insertion of, from the front to behind, we have the insertion of the piriformis muscle, obturator internus, together with the superior and inferior gemellus muscle, and we have this depression on the medial aspect of the greater trochanter. This depression is called the trochanteric fossa, and this trochanteric fossa actually it is the area for insertion of the obturator externus muscle. Okay, then let us discuss the feature of the shaft of the femur. Regarding the shaft, this is the anterior surface. It is convex forward, and it is as you can see, it is a smooth surface. It is a smooth surface. Posteriorly, here the surface of the shaft is more or less rough. It is rough than the anterior surface, and has this line or ridge in the center of the posterior surface. This is called the linea aspera, and when you follow the linea aspera superiorly and inferiorly, it has a number of two divergences. One divergence passes laterally and the other passes medially. The superior lateral divergence here will lead to this area called the gluteal tuberosity. Okay, and this gluteal tuberosity for insertion of most of the gluteus maximus muscle fibers. Okay, for insertion of gluteus maximus muscle, and the other part will be inserted into the iliotibial tract. Okay, in this area we have the lateral ridge, okay, of the linea aspera, and from this lateral lip we have the origin of the vastus lateralis, which is one of the muscles of the anterior compartment of the thigh that form part of the quadriceps femoris muscle. Okay, then this is called the medial divergence of the linea aspera, the medial superior divergence, and when we follow it, it will lead to this line. It is called the spiral line, and anteriorly will lead to intercondylar or intertrochanteric line. Okay, then this medial lip together with the spiral line here, okay, will give an origin to the vastus medialis muscle. Okay, vastus medialis will take an origin from the medial lip of the linea aspera. Okay, then when you go downward, this lateral divergence will lead to the, it's called the lateral supracondylar ridge, okay, and will lead to the lateral epicondyle. And the medial divergence, medial lower divergence here, will lead to the medial epicondyle here, okay. So this is a feature of the shaft of the femur, and you have to know that this linea aspera is an area that rich in muscular attachment, okay, in between the two lips, namely between the vastus lateralis lateral and medialis. We have many insertions, like the insertion of the pectineus muscle superiorly, the adductor, all adductor muscle, adductor brevis, longus, and magnus will be inserted in between the two lip of the linea aspera, okay. Then let us see the lower feature, or the feature of the lower end of the femur. Regarding the lower end, we have these two condyles. This is called the medial condyle of the femur, and this is called the lateral condyle of the femur. And these two condyles will articulate with the condyles of the tibia to form the knee joint. Anteriorly here is the surface for the patella, okay. So as you can see here, the lateral tibial condyle protrudes more than the medial condyle, but the medial has more articular surface than the lateral, okay. When we see the medial condyle from the medial side here, we have this protrusion from the medial condyle. It is called the medial epicondyle, and this medial epicondyle will provide attachment for the medial collateral ligament of the knee, okay. Laterally we have, or also medially, sorry, above this medial epicondyle, we have this tubercle. It is called the adductor tubercle, and this adductor tubercle is for insertion of the adductor magnus, the adductor magnus here, and upon insertion it leaves a hiatus that will provide a passage for the femoral vessels in order to pass from the anterior surface of the femur into the popliteal area, okay. This is called the adductor tubercle for adductor magnus. Laterally, when we turn laterally, we have this protrusion from the lateral femoral condyle. It is called the lateral epicondyle, and this is for insertion for the lateral fibular ligament, or the lateral collateral ligament of the knee, and for popliteus muscle also, okay. Above here, above the lateral epicondyle, from the lateral supracondylar ridge, we have the origin for the lateral head of the gastrocnemius muscle, and medially we have the origin of the medial head of the gastrocnemius muscle. The gastrocnemius muscle is one of the muscles that form the superficial layer of the posterior compartment of the leg, and we will see it inshallah when we will discuss the posterior compartment of the leg, okay. We have also the plantaris muscle, take an origin from the supracondylar ridge here, okay. So these in general the features of the femur, the upper end, the shaft, and the lower end. And let us see the other small bones that articulate with the femur. This bone is called the it's called the patella, okay. This is called the patella, and actually the patella is a small sesamoid bone, and when we say sesamoid bone, it is like the like a soap, okay. And actually it is the largest sesamoid bone in the body, but in general it is a small bone, but it is the largest sesamoid bone. You can see here in the articulated skeleton, or in the articulated knee, we have here is the left femur, and here is the tibia and fibula, and here we have the patella articulated here with with the femur. Okay, then the patella, it is like a rounded triangle, like a rounded triangle with its apex downward here and its base upward here. Okay, the patella has, this is the base and this is the apex downward. As you can see, it is like a rounded triangle. Okay, then it has an upper surface here, an anterior rough surface, it is non-articular, and a posterior smooth surface, which is articular surface. The whole patella is found inside the tendon of the quadriceps femoris muscle, which is the muscle, compound muscle of the anterior compartment of the thigh. Okay, then when we see the patella from behind, from the smooth surface here, we have two surfaces that is divided, or that are divided by this vertical line. Okay, you can see this ridge, and from it we have this vertical line, and this vertical line will divide the articular surface of the patella into larger lateral surface and a smaller medial surface. Okay, and if you put this patella in anatomical position, we need to differentiate between the right and the left patella. Okay, then you put the apex downward and the base upward and the larger lateral surface laterally. So this is left patella. Okay, and also you can put it on a flat surface, and if you put it on any flat surface, then the patella will drop on the lateral surface. Okay, then this patella now is dropped on the lateral surface. So then this is the lateral surface of the patella, that indicates it is the left one rather than the right. And if you would like to compare, this is another patella. Okay, this is another patella. This is the articular surface, and here we have the ridges that divide the articular surface into larger lateral surface, and this is a medial surface. Again, if I put it on my hand here, okay, it will drop on the lateral surface. Then this is the lateral one, and then this is the upper surface, and this is the apex of the patella. So this is the right patella. Okay, you can do this test by putting the patella on any flat surface, and the side that will drop is always the lateral side of the patella. Okay, so this is all about the femur and the patella, and this is the end of this station. Okay, in this station we will discuss the bones that form the leg, namely the tibia and fibula. Firstly, we will discuss the individual features of each bone, then we will see them articulating together. In front of you here, you can see this tibia, and actually this is right tibia. You have to differentiate in any bone to which side it belongs. Okay, then this is the right tibia, and I will tell you the features that you can differentiate the right from the left tibia. Okay, as we discussed in the femur, the tibia also we have the upper end, shaft, and lower end. The upper end of the tibia has two condyles. This is the medial condyle, and this is the lateral condyle, and each condyle on its upper surface has characteristic prominences that we can see it when we tilt this bone on its upper side. Now you can see this is the upper surface of the tibia. This is the upper surface of the medial condyle, and this is the upper surface of the lateral condyle, and this surface is called the tibial plateau. Okay, it is called the tibial plateau. In between the two tibial plateaus, we have this projections, bony projection is called the medial and lateral intercondylar eminences. Okay, is called the medial intercondylar eminence, and this is called the lateral intercondylar eminence. In front and behind to these eminences, we have the anterior intercondylar area and the posterior intercondylar area. Okay, the anterior and posterior intercondylar area will give an attachment to the anterior and posterior cruciate ligament, which is one of the ligaments of the knee joint, and the intercondylar eminence will prevent the tibia to sway side to side on the femur. Okay, it plays part in the stability of the knee joint. So we have the tibial plateaus, we have the intercondylar eminences, and we have the anterior and posterior intercondylar areas. Okay, this is regarding the upper features or the upper feature of the upper surface. In the front, you can see this bony projection here. This is called the tibial tuberosity, and this tibial tuberosity will provide an insertion for the patellar ligament. Okay, the patellar ligament, it is the ligament that passes below the patella, and it is the insertion of the quadriceps femoris muscle, which is the muscle of the anterior compartment of the thigh. Okay, then above here, this is the lateral tibial condyle. We have this projection here. It is called Gerdy's tubercle, and this Gerdy's tubercle, it is a tubercle for insertion of the iliotibial tract, which is the thickening of the lateral part of the deep fascia of the thigh that will be eventually inserted in this area. Okay, turning to the posterior side of the tibial condyle, we have this groove behind the medial tibial condyle, and it is a groove for semimembranosus muscle. Semimembranosus muscle will be inserted in this area. Okay, on the medial side of the tibia, of the upper tibia, we have this area, and this area, it is for insertion for a number of 3 muscles that form a characteristic gauze-like foot or gauze foot. It is called pes and serenus, and this pes and serenus will form from the sartorius muscle anteriorly, and behind it gracilis, and the most posterior is the semitendinosus muscle. And these 3 muscles will come from the anterior and medial compartment of the thigh, as you will see it later. Okay, so this is the feature in general of the upper end of the tibia. On the lateral side, we have this. Where is it? We have this groove, a smooth groove here for the head of the fibula. Okay, for the head of the fibula, and downward here also a smooth groove for articulation with the fibula. And let us see the shaft of the tibia. Regarding a shaft, we have, this is called the anterior border. Okay, we have borders and surfaces. This border coming from the tibial tuberosity and passes downwards here, and you can palpate it easily on yourself below the skin immediately, is called the anterior border of the tibia. Okay, this anterior border will divide the tibia into surface that found medially and lateral to it. Okay, this is called the medial surface or the subcutaneous surface of the tibia, and this one, it's called the lateral surface of the tibia. It's called the lateral surface of the tibia, and this lateral surface will provide an origin for the tibialis anterior muscle, which is one of the muscle of the extensor compartment of the leg. Okay, then lateral to it, to this surface, you can find this border. It is called the interosseous border. Okay, and this interosseous border will lie side by side with the interosseous border of the fibula and connected together by the interosseous membrane. Okay, this border. Behind the interosseous border, we have this, the posterior surface. Okay, we have the posterior surface of the tibia. Okay, and just medial to the posterior surface, we have the posterior border. Then the posterior border found between the posterior surface found between the posterior border and the interosseous border, enclosed between the two, and the medial surface between the posterior border and the anterior border, and the lateral surface between the interosseous border and the anterior border of the tibia. Okay. Now, as I said, this is an area, the lateral border here. This is an area for origin of the tibialis anterior. The posterior surface here gives an origin for the tibialis posterior muscle and other deep muscle of the posterior compartment of the leg. Okay. Behind here we have this rough line. This is called the oblique soleal line. This oblique soleal line will give an origin for the soleus muscle, and the soleus is one of the superficial muscle of the posterior compartment of the thigh. Above this oblique soleal line, we have this area, this triangular area. It is called it is an area for attachment of the popliteus muscle. Okay, popliteus takes an origin from this area. Okay. Now let us see the feature of the lower end. The lower end had this protrusion, and this protrusion, it is called the medial epicondyle, or the medial malleolus. Sorry, the medial malleolus of the tibia. And actually, the medial malleolus is formed by the tibia, and the lateral one is formed by the fibula. Then, lateral to the medial malleolus, we have the surface for articulation with the talus at the tibio-talar joint, or the ankle joint. Okay. Behind the medial malleolus, we have this groove, and this groove for the tendon of the tibialis posterior muscle and long flexor muscles. Okay, is give this groove behind the medial malleolus. Okay, medially we have this surface for the lower part of the fibula, is the medial here. Okay, so this is in general the feature of the tibia. And how we differentiate the right from the left, it is very easy to put this tibial tuberosity in front, okay, or on the anterior surface, and the medial malleolus on the medial surface, and this is the tibial plateau superiorly. Okay, and this is the subcutaneous border. If you put it in the anatomical position, you will find this is the right tibia. Okay. Okay, this is the second component in the osteology of the leg, and this is called the fibula. And the fibula, it's always found lateral to the tibia. As you can see, it's a long slender-like bone with upper end. This is upper end shaft and lower end, as in any long bone. In the upper end, we have the head of the fibula, and the head actually will articulate here superiorly with the fossa on the lateral condyle of the tibia. Okay, this will form the superior tibio-fibular joint, and it is a type of synovial joint. That is a plain synovial joint. Okay, this is the upper part. This is called the apex. It is called the apex of the head, and below it we have the neck area here, and the neck connects the head to the shaft. When you follow the shaft downward, you will find that it has this sharp border. This is called the interosseous border of the fibula, and this border will faces towards the interosseous border of the tibia. Then it will face always medially. Okay. Lateral to it, we have this another border here. It is the anterior border of the fibula. Okay. Between the anterior border here and the medial border or the interosseous border, we have this is called the extensor surface of the fibula. Extensor or yes, this is extensor surface of the fibula that will give rise to the extensor muscle of the leg, or the anterior compartment of the leg. Lateral to the anterior border here, we have this surface. Okay, and this surface is called the lateral surface, and this lateral surface has another name. It is called the peroneal surface, and this surface will give rise to the peroneus longus and brevis, which forms the lateral compartment of the leg. Okay, behind the lateral surface here, posteriorly, we have this whole surface. It's called the posterior surface or the flexor surface, and this posterior surface will give rise to the origin or attachment to the muscle of the posterior compartment of the leg. Okay, you will find compartment muscles, the flexor hallucis, the flexor digitorum longus, and the tibialis posterior, and also it give origin for the soleus muscle. Okay, and all this will passes downward, and some of them may leave groove behind the malleoli of the tibia and fibula. Okay, this projection, this lateral projection here, it is called the lateral malleolus, and the lateral malleolus is formed by the fibula. Okay, behind the lateral malleolus here, we have this depression. This is called the malleolar fossa, and it always sits on the posteromedial aspect of the bone, and we use it as a useful guide when we put the bone in the anatomical position. Okay, then when you put this fibula in anatomical position, the malleolar fossa will or should face posteromedially like this, and this is the upper end, is the head, and the interosseous border will face medially. Then this is the right fibula. Okay, and this lower facet here medially, it is the facet for the distal tibiofibular joint, which is a fibrous joint. Okay, the fibrous joint. So this is in general the feature of the fibula. Here in this articulated model, you can find that this is the fibula. Okay, this is the articulated model of the left leg. Okay, this is the left bone, it is the fibula, and the right one is the tibia. They are articulated superiorly here to form the proximal tibiofibular joint, which is a synovial joint, and distally here they will form the distal tibiofibular joint, which is a fibrous joint, and distally this is called the talus. We will see it in a minute, and this talus will articulate with the articular part of the tibia to form the tibiotalar joint or the ankle joint. Okay, and this is the end of this station. Okay, in this station we will discuss the bones that form the foot. As you can see here, this is the foot as a whole, and the foot is divided into 3 regions. This area it is called the forefoot, and the mid area here it is called the midfoot, and the back of the foot is called the hind foot. We will discuss the individual components of the foot and to describe the joints that forms in between them. The first one here, actually to give you some orientation, this is the left foot, okay, because this is the big toe on the medial side and this is the little toe on the lateral side. So this is the left foot. The upper bone here, this one, it's called the talus, and this talus will articulate with the articular surface or the distal surface of the tibia to form the tibio-talar joint, which is the other name for the ankle joint, okay. Then the ankle joint, as you can see it here clearly, this is the talus articulated with the distal part of the tibia, okay. It is not articulating with the fibula, it's only with the tibia. So this talus had its upper end. This upper end is called the trochlea, which articulate with the tibia, and anteriorly we have the head of the talus, and this head of the talus will articulate with the next bone, that is the navicular bone, at the talonavicular joint, okay. It is called the talonavicular joint. Behind the neck here, behind the head we have the neck of the talus, and on the undersurface of the talus we have the articular surfaces for the calcaneus, okay. And this undersurface of the talus will form what is known as the subtalar joint with the calcaneus, okay. This is the second bone here. It is the calcaneus bone, and when you see it from below here, it has two prominences. This is called the medial or the lateral and medial calcaneal processes, okay. On the back we have this rough area. It is called the tuberosity of the calcaneus, and here it is the insertion of the Achilles tendon, which is a common tendon for the gastrocnemius, soleus, and plantaris muscle, which are the muscle of the posterior compartment of the thigh. On the lateral aspect, we have this projection. It is called the peroneal trochlea, and this trochlea will divide the tendons of the lateral compartment of the leg, which are the tendon of the peroneus longus and peroneus brevis. The peroneus brevis will pass above the trochlea, and the brevis below this trochlea, okay. On the medial aspect, we have this characteristic projection. It is labeled in blue here, okay. It is labeled with ink here. This is called the sestentaculum tali. Sestentaculum tali, it is the medial projection, and it bears the medial or the medial articular surface for the talus, okay. Behind it we have the posterior articular surface, and in front the anterior articular surface. The sestentaculum tali below here, it's grooved by the tendon of the flexor hallucis longus, which will pass from the posterior aspect of the leg directly into the big toe, okay. This is the undersurface. This is the sestentaculum tali. It is a very characteristic and commonly asked in exams, okay. Then these two bone will articulate anteriorly with other components of the tarsus, okay. This is called the tarsus. As I have already said, the talus will articulate anteriorly with the navicular at the talonavicular joint, and the cuboid laterally will articulate with the calcaneus laterally will articulate with the cuboid, sorry, okay. The calcaneus will articulate anteriorly with this bone. This is called the cuboid, okay. In front of the navicular we have these three bones. It is called the three cuneiform. It is called the three cuneiform. This is called the medial, intermediate, and lateral cuneiform, and the three articulates with the navicular posteriorly to form the cunei-navicular joint, okay. Then this in general the bones that form the tarsus. Okay, this tarsus will articulate with the bones of the midfoot or with the metatarsal at the tarso-metatarsal joint. This is the tarso-metatarsal joint, and this is the mid-tarsal joint. Okay, this is the tarso-metatarsal. These are the 5 metatarsals of the foot. This is the first one, this is the second, third, fourth, and fifth. Okay. What is characterized the fifth metatarsal is having this tubercle, or this is called the tuberosity of the fifth metatarsal. Okay, and this protruded area, it is provided for the insertion of the peroneus brevis muscle. Okay, peroneus brevis muscle will be inserted in this fifth metatarsal tuberosity. On the upper surface here, we have the insertion of the peroneus tertius, which is one of the muscles of the extensor compartment of the leg. You will see it later, inshallah. Okay. Below here, on the undersurface, you can see this groove on the cuboid bone. It is formed by the tendon of the peroneus longus muscle, and this groove here, okay, this area here for attachment of the tibialis posterior muscle. It is mainly attached to the navicular bone and to all other cuneiform. Okay, it gives insertion here, but mainly to the navicular bone. This is the peroneus or the tibialis posterior. Okay, regarding this is the first metatarsal. Okay, on the head of the first metatarsal, on the medial aspect, we have the insertion of the tibialis anterior muscle, and on the lateral aspect, on the medial aspect of the head of the first metatarsal, we have this is a sesamoid bone, and on the lateral side, this is another sesamoid bone. Okay, and both of them will provide a passage in between for the tendon of the flexor hallucis longus, which will be inserted in the distal phalanx of the big toe. Okay, on each side we have origin for the medial and lateral head of the flexor hallucis brevis. Okay, on the base of the first metatarsal here and the medial cuneiform, on the medial side we have the insertion for the tibialis anterior. On the lateral side we have the insertion for the peroneus longus muscle. Okay, these on the base, not for on the head. Okay, let us continue to demonstrate the other bones that forms the foot. The head of the metatarsals, and the head of the metatarsals will articulate distally with these bones, and these bones are the phalanges. Okay, then these are metatarsophalangeal joints. Okay, these are the metatarsophalangeal joints. We have a number of 3 phalanges: the proximal, medial, and distal. For the lateral 3 toes, and with the first or the big toe have only proximal and distal phalanx, as in the hand. Okay, on the undersurface here, you can also appreciate the phalanges has their bases proximally and distally. They have the head. Okay, and in between this space we will find the muscles of the deep foot. Here the interossei muscle. Okay, the interossei is a dorsal and plantar interossei muscle, and we will see it in details, inshallah. So these in general the features of the bones that form the foot. And in summary, this is the talus articulate with the distal tibia to form the ankle joint, and this is the calcaneus which articulate with the talus and in front articulating with the cuboid at the calcaneocuboid joint. Medially we have this is a navicular articulated with the talus at the talonavicular joint, and this is called the mid-tarsal joint. Okay, the navicular will articulate with the 3 cuneiform to form the navicular joint here, and in between the tarsus and this is the metatarsus, and this is the base of the metatarsus, we have the metatarso or the tarso-metatarsal joint, and the tarso-metatarsal joint will connect the basis of the metatarsal to the cuneiform and the cuboid bone. Distally we have the metatarsophalangeal joints, and in between the phalanx we have the interphalangeal joints.